Guys, this one will go back to healthcare reforms, and we just was interrupted by other things, and then we had just one part one, but now we this will be the part two, and also I want to make a forecasting because I have some videos on China's bubble not popping up, and then that's the so far is the record number about more than 1,000 viewer on the YouTube. So I think I'm gonna inspired by that. I'm gonna do more because one thing I can guarantee you is that I'm from China. I'm a Chinese. I can read and write in Chinese very well, and so it's easy for me to understand to read in between the lines on the news about China, and I want to share that with you guys. And we're gonna have a playlist called Peeking into China, and then to share with that because I believe that this country, a lot of people don't really have much knowledge, but they're not too shy about making some statement about China. And we need some truth. We need some people stay neutral, stay balanced, to tell people the truth and enlighten people, I guess. Um, so we're gonna walk into that. But for now, let's finish this healthcare reform thing. Last time we had a big picture view, and we talked about Brian Thompson was killed by the assassinators and then stuff like that. This time, I want to share that a few case studies that I read online. That's interesting. There's one thing. There's one case that somebody lived in physically in one state, but very close to another state, and then as a result, she was like mistakenly sent to another state. Obviously, it's out of a network. Obviously, the insurance will refuse to pay that. So, and obviously, they ended up, claim bankruptcy eventually to get it off their shoulders, their responsibility. But I was just thinking that cases like this really it's easy. I said that the last time, a lot of generative AI or agentic AI will take care of it. Especially if we are prepared, we know something that we can pre-enter the data, and then so instead of a last minute, we will forward to a wrong place, wrong hospital. The AI, generate agentic AI in our phone will take care of it, prevent that from happening. So that's the more deeper solutions than ended up claiming bankruptcy. Okay, that's 10 times better than that. And then there's another story that is also involved in United Health. This one couple, um, the mom was like 2 months premature labor, and then it's interesting that on the day that she gave labor, before the midnight was another insurance company. Okay, but after midnight, United Health took over. So the baby was like 2 months earlier and it coming out on the same day when the United Health switched to take care of to take the responsibility for covering that mom. But what is funny is that the United Health refused saying that, refused to pay it. They say that's not our responsibility, even though it is, because it's on the contract. Even though the patient may not know, but this document shows up that clearly shows that after midnight, United Health will be taking care. So next morning, the baby was born. Whose responsibility is that, right? And the funny thing is that this couple, you know, has been, sitting in the hospital and then received so many, collection phone calls and the bills are bombarded. Okay, and what happened is that the the couple have some resources. The couple's company, her husband's company, decided to hire a lawyer to sue the United Health. And then that's when the situation changed. The United Health finally paid it. Okay, so this is hassles like that. It's really that's I think that's really a very clear story that United Health is not ethical. Okay, they there's no spiritual of sticking to the contract and doing your job and pay your bill. Okay, and they refuse to do that. That's really a shame. Okay, there's some a bunch of other things. Another case that there were also something got wrong, and then they ended up finally claim bankruptcy. But before they claim bankruptcy, they already have emptied all the other ways. So it is real bankruptcy. They're not playing the game. Okay, so cases like that, I have a few solutions. One is that you have to have some app, generative AI on your app, on your phone, and then to prevent things happening. And also, once you're in a hospital, whenever you have an interaction with another like a healthcare, press the button to record the situation, record scenario, record the conversation. So that way you leave a trail. Basically, you have a data trail. So you can, wherever you go to the court or go to the mitigations, you always have something to rely on. So that's the thing. Another thing that I really want to say is that a lot of healthcare is concerning everybody else. One big idea that I think is that Congress really should take over of this. The way to do that is that the Congress don't sit there and waiting for the research to be done and send a report to them. I really think that Congress should take a more active role to make science their job, daily job, not just the debating, in the Congress and then, for years and for days and for months without solving anything. We have to, especially the membership, the committee members, they should be actively sponsoring research. Okay, that way they take the ownership of the research. So instead of sitting there waiting for the report, they take the active role. And that way, they have a sense of responsibility, and then they can, make their legislation job easier because they can always have some scientific research to fall back to before they can talk it pure politics. Okay, so that's one thing that we all know that the Supreme Court is all about the documents, all about the scientific research, right? But the Congress should do that too. You have to. It's a difference between day and night. To just sitting there receiving the report done by others, then they themselves, actively taking care of it, sponsor the research, and then because in the name of public interest. Okay, so you make your all the decisions more science based instead of partisan politics based. Okay, let's stop here.